Canada's chief public health officer says it's possible that this year's flu vaccine may have limited effectiveness against a particularly severe strain of influenza A that appears to be dominant throughout Canada. In Canada, it's still too early to actually tell how effective this vaccine will be, Dr. Theresa Tam told CBC News. There is a potential of low vaccine effectiveness, but we really can't tell at this point in time. The reason for believing there's a potential weakness in the vaccine, Tam said, is the fact that countries in the Southern Hemisphere, which have their flu season before Northern Hemisphere countries, experienced poor vaccine effectiveness against H3N2, a subtype of influenza A that tends to cause more severe illness among vulnerable people, including the elderly and children. In addition, studies suggest that the process of manufacturing the vaccine may have compromised its effectiveness against H3N2 because it can mutate when grown in eggs, and Canada uses egg-based vaccines. Tim said, "Get your flu shots," health officials urge amid concerns about bad season vaccine manufacturers. The World Health Organization and others are studying the situation to determine if that was the case, she said. Doing so is very important, Tim said, as we move ahead to future years of vaccine program planning and recommendations. Influenza B appearing early. The potential for lower vaccine effectiveness makes it even more important that Canadians take other measures to protect themselves against the flu, she said, including hand washing, coughing into your sleeve, disposing of used tissues, and staying home when you're sick. Tam said there are also antiviral medications, such as Tamiflu and Zanamivir, to treat flu and help prevent outbreaks in long-term care homes and other facilities, but people should still get the flu shot, she said, because it offers protection against multiple strains. Given the mix of influenza virus is circulating right now and more could still circulate later on in the ensuing months, we still recommend influenza vaccine for Canadians over 6 months of age, she said. Annual flu shot reduces severity of illness in seniors. Study finds one type of flu that's circulating earlier than usual this year is influenza B, according to data released by the Public Health Agency of Canada, PHAC, in its latest Flu Watch report on Friday. What's important about influenza B is actually its impact on kids, Tam said. Anyone that's had influenza, and I mean real influenza, not a sniffle or a cough or a cold, but real, true influenza, they'll know how severe this can be, says Dr. Isaac Bogic, an infectious disease specialist at University Health Network in Toronto. Although children are more susceptible to serious illness from H3N2 than the general population, they are also particularly vulnerable to the B strain, possibly because of their lack of previous exposure, she said. Tam said that given the burden of influenza B on kids, the National Advisory Committee on Immunization recommends children receive the quadrivalent vaccine, which protects against 4 strains of flu, including 2 B strains. The quadrivalent vaccine available in Canada right now covers the B strain that is currently circulating, she said. The other type of vaccine, called trivalent because it covers 3 strains of flu, unfortunately, doesn't cover that B strain. Parents can ask their local public health agencies which vaccine is available in their area, she said. Flu in full swing. The latest Flu Watch report also says the number of flu cases overall continued to rise across the country in December, but are within the range of expected levels for this time of year. The type of flu detected is mostly H3N2, although influenza B detections continue to increase. Influenza is in full swing in Canada, said Tam, in noting that this year's flu season started earlier than normal. As of Dec. 1,050 influenza-associated hospitalizations had been reported, with 93 cases requiring admission to intensive care. There have been 34 reported deaths. Seniors have been the worst affected, accounting for the majority of hospitalizations and deaths. The flu has also taken a toll on kids, with 195 people under age 18 admitted to hospital as of Dec. 30. There have been fewer than 5 pediatric deaths. PHAC's flu surveillance data are consistent with what healthcare providers are observing, said Dr. Isaac Bogic, an infectious disease specialist at University Health Network in Toronto. There are early indicators that this influenza season is a little bit more severe compared to prior influenza seasons. Certainly we're seeing that in the hospital, he said. We know that the years when there are H3N2 strains that predominate, those are more severe years, meaning there are typically more infections, more severe infections, more hospitalizations and more deaths. Best protection we have, Bogic said. The potential weakness in the flu vaccine's ability to protect against the H3N2 strain is an issue this year, noting he's seen early data suggesting it may be only 10% effective. Despite that, he said, it's still extremely important to get the vaccine. Anyone that's had influenza, and I mean real influenza, not a sniffle or a cough or a cold, but real, true influenza, they'll know how severe this can be, Bogic said. I think many people would readily take that 10% reduction in risk just because this can be such a debilitating and severe illness. Even though it's not perfect, it's still the best protection we have.